How does autoimmune pancreatitis increase pancreatic cancer risk? Autoimmune pancreatitis is a rare form of chronic inflammation of the pancreas driven by the immune system. It is part of a broader condition called immunoglobulin G for related disease, which involves immune cells attacking the pancreas and causing swelling and tissue damage. Unlike typical chronic pancreatitis caused by alcohol or other factors, autoimmune pancreatitis involves immune system dysregulation, which makes understanding its link to pancreatic cancer complex. Current research shows that the connection between autoimmune pancreatitis and pancreatic cancer is not yet clearly established. Many studies are limited and do not definitively prove that autoimmune pancreatitis directly increases cancer risk. However, there are some factors to consider. In autoimmune pancreatitis, the immune environment is altered, with a dominance of Th to helper T cells, which promote antibody production and can suppress certain immune responses that normally help detect and destroy emerging cancer cells. Additionally, immune cells called macrophages tend to support tissue repair but may also create conditions that favor tumor growth. Basophils, another type of immune cell involved in inflammation, can influence immune regulation in ways that might support cancer development. These immune changes could impair the body's natural ability to detect and eliminate early cancer cells, a process known as tumor immunosurveillance. When this process is weakened, abnormal cells may grow unchecked, increasing the chance of cancer formation. Moreover, patients with autoimmune pancreatitis often receive immunosuppressive treatments like corticosteroids to control inflammation. While these medications help reduce tissue damage, they can also suppress immune responses that normally help prevent cancer, potentially raising the risk further. In contrast, ordinary chronic pancreatitis, which results from repeated injury and inflammation often caused by alcohol or gallstones, is a well-known risk factor for pancreatic cancer. The ongoing damage leads to genetic mutations and the development of precancerous lesions called pancreatic intraepithelial neoplasms. These can progress to invasive pancreatic cancer, and the risk in chronic pancreatitis is significantly higher, with some studies suggesting a relative risk up to 68 times greater than the general population. To sum up, autoimmune pancreatitis might increase pancreatic cancer risk indirectly through immune system alterations and the effects of immunosuppressive therapy. However, the evidence is not as strong or clear-cut as it is for chronic pancreatitis. Patients with autoimmune pancreatitis should be monitored carefully by healthcare professionals, but overall, their risk of developing pancreatic cancer appears to be lower than in other forms of chronic pancreatitis. Understanding these differences helps in planning appropriate surveillance and management strategies. Always consult with a healthcare provider for personalized advice, as individual risk factors and health conditions vary widely.